So I did get the recording notice.
Perfect.
So,
And it is 10 a.m., so I'm going to go ahead and admit all.
okay.
Oh.
So good morning to everyone. We'll get started in just a moment when all of our attendees are admitted. And so Kim, can you let me know when the bulk are in?
We are good to go.
Okay. All right. Good morning, everyone. Thanks for joining us today to learn more about Licensee, our online self-guided license application platform that launched this year in May. I'm Jennifer Garrett. I'm the Department of Safety and Professional Services Assistant Deputy Secretary, and I'll be helping with the session today. I'll start with some quick introductions. Secretary Dan Harris will be our master of ceremonies today. I'll be handing things over to him in just a moment. Also behind the scenes is Kimberly Wood. She's available to make sure things run smoothly, and if we run into any technical glitches, she'll help us resolve those. So before we officially begin the program, I want to go through a few orders of business. First, be aware that all attendees will be muted throughout the entire session. Anyone with a question should type that into the chat and address it to me. Again, my name is Jennifer Garrett, and the question should be addressed to me. There will be a few other people that you'll see that you could address questions to, but those won't make it into the forum. So please make sure you use my handle when you type in your question. Let me see. So then I'll triage those questions and field them to the secretary. With that, we just try to cluster like questions so that we're not asking the same one over and over again. So I quickly scan themes and topics and try to capture those in the most general way possible so that the answers appeal and are relevant to the widest group of participants. We will also save all the questions that are in the chat. So if your question doesn't get posed and there's a specific issue that requires follow-up, we will do those directly after the meeting. And then I want to encourage you to visit our website, dsps.wi.gov. There is a link to our licensee information page, and there's some user guides there, some videos, and some other tools and resources. There's also a way to sign up for emails so that you can get future notices when we make enhancements or have significant news about licensee. As you may have noticed, we have a sign language interpreter here, and we will be captioning the sessions. We're also recording the session, and if there's no problem with the recording, we'll post it on our website afterwards. So before I hand things over to the secretary, Kimberly is going to play a quick short video, and then Secretary Harris will take the reins and get us started.
This is your future. It's where you want to be and where you want to build your career. You have done the hardest part. Now it's time to put your education and skills to work. You're ready to help keep individuals, families, and communities healthy, happy, and safe. There's just one more step: your license. The Wisconsin Department of Safety and Professional Services is pleased to present Licensee, our online self-guided application system that makes applying for your license as easy as possible. With Licensee, you'll be on your way to joining the workforce and making a difference for the people of Wisconsin. You can create an account, access, complete, and submit an application, review and manage your application and account, and find additional resources and support. Your future is at your fingertips. Visit licensee.wisconsin.gov today and continue your journey to becoming a licensed professional.
I think that's my cue. Good morning, everyone. Thank you for joining us. I do note that there are a few people in the room I recognize. Wanted to thank Ann Zink from the Wisconsin Hospital Association for joining us this morning. Ann and I have worked closely together over the last couple of years now, really since the start of the pandemic, working towards creating accessibility for our hospital systems and our clinics to access providers throughout the state of Wisconsin. We're holding this session now. This is our first session since we did our initial 2 sessions a few months ago. In those sessions, we learned a lot of valuable information, which we have been working to both incorporate in the platform as it exists today, as well as in our future iterations, our contracts for future iterations as we plan for the future of this program. I think one of the things that we tried to do in the creation of this program was to make it as driven by the applicant as possible, right? We wanted the applicant really to be able to own the process from start to finish and drive forward each piece of the process, whether or not the applicant was responsible for providing the material directly, or they were responsible for working with a third party to provide that material, be it test scores or proofs of graduation or a number of other items. I think we developed this program in roughly 6 months, start to finish, and certainly are very, very proud of the work that we were able to accomplish in such a short time frame. For those of you who've been involved in technology projects before on this scale, that's an incredibly fast development period, and that was certainly why we chose some of the partners we chose to move this project forward. I do want to call out a few things that I think were top of mind when we had our last Q&A sessions. There was discussion by especially our educational institutions about because many of the people who work for educational institutions had gone through the application process in previous years. They didn't necessarily have visibility on how to help guide their applicants in the new process. And so as a result of that feedback, we are actually in the process of developing 2 tools. The first is going to be an event-driven tool. It is there'll be an open house period coming up in, I believe sometime in September. Dates are TBD at the moment, but we're firming those up now. It'll be, I believe, about a 2-week period where anyone in a secure environment can log in and really just get to know the system. So especially for our providers, our recruiters, and our educational institutions, they'll have a better understanding of how to help their applicants and employees work through the process. The second set of tools that we'll be rolling out between now and December in preparation for our second graduating class in the system is a set of profession-specific user guides. So currently, many of the tools on our website are general user guides, and while the process is substantially similar profession to profession, there are nuances both in the program as well as even further nuances in the material that the applicants are being asked to provide based on the relevant statutes and laws. And so we'll be rolling out those guides that will really step people through the process at a very granular level. Another item that had come up in previous discussions was the proof of graduation process, particularly for our nursing students. Every semester we have thousands of nursing students who graduate and enter the workforce, and one of the key components prior to being authorized to test is the review of proof of graduation materials. I'm pleased to say that I'm working directly with the nursing board in order to adjust the order of that process to allow more flexibility in receipt of that proof of graduation, to allow students to test nearly immediately upon graduation. And we intend to have that implemented by the December graduating class of this year, 2022. The last item, which I think has been of great interest both to our provider community as well as to some of our educational institutions, is application lookup. So our traditional application lookup tool, so we have, I should say, we have two tools. One is both the credential lookup, which is for those individuals who are currently credentialed, and that tool allows folks to verify that a person is credentialed. And then we have the application status lookup tool. And so what I'm referring to here is the application status lookup tool. Just last week, I participated in a roundtable with Marshfield Clinics. We have additional roundtables scheduled with other providers throughout the state of Wisconsin. And what we're really doing is a mini discovery session to determine how to create a tool that provides them with the information they need on the status of an application, while protecting applicant information that may be sensitive, such as legal review information. And so I will say that while we're developing that tool, the applicant still at any time can log into the system and see their checklist and see what is missing, as well as the notes that have been made by the department on how to fulfill requirements. So as I discussed at the open, with the process being applicant driven, that's another piece of the process, is that there's full visibility by the applicant at any time on how to move their process forward. So with that, I think we can get into the demo. Just a brief reminder that this demo is based on an advanced practice nurse prescriber license. Like I mentioned earlier, it will be reflective of the process generally for applicants, but there will be some nuanced differences profession to profession, which again is why we are adding those profession specific user guides for our applicants and our educational institutions in particular. So with that, Kim, if we could play the video.
All right, so upon landing on this homepage, Arthur is going to need to initially register for an account so that he's able to complete and submit his application. So to do that, we'll click on this register for an account button, and that's going to open up a registration form. On that registration form, Arthur would provide things like his first name, last name, email address, set up a password, date of birth, social, his home address, as well as a different mailing address if needed, as well as his phone number. When I click this register button, there are a few things that or a couple things that happen. The first thing that's going to happen is I'm going to receive an email from the system notifying me that I've registered for the licensee portal and giving me a link to be able to go and log in on that portal. Along with that, the application will sign me in and bring me to this landing page for applicants. So this is the first page that's seen after an applicant logs into the portal. Once that registration process is completed, we're really at that point ready to begin the application process. And again, Arthur's looking to apply for that advanced practice nurse prescriber license. So I can see I have a question here: what license can we help you apply for today? And a drop down filled with license types. So in this instance, I'm going to choose advanced practice nurse prescriber and click next. The very first screen in the application flow is really one where we're asking which application method are we going to be using to apply for this license? So for today's demo, I'm going to be selecting licensure by examination. And once I'm ready to begin my application, I can then use and click on the next button, which would open up an application flow and really get me into the application proper. Landing on the application flow, the very first step that we run into is our instruction screen with some brief instructions about what needs to be provided and how to complete this application. We can move through to the next step of the application by using the next button. And that's going to bring me to the personal information step of the application. So here we're collecting demographic information, validating that we have the right name, the right date of birth, ethnicity, gender. Also, we have our contact information. And as you can see, that is editable so that if they need to update that information via this application intake flow, they can certainly do that by updating their phone number or changing their home or even changing their mailing address as well. After the user has input all of that information, we have some additional questions based on the advanced practice nurse prescriber, asking whether we've been licensed, what's our primary state of residence, do we currently hold a registered nurse license, and what are our current certifications. So we'll click Save and Next, and that's going to take us to the next step of the application, which is going to be our school information. And as you can see, ahead of time, I've already added in the two schools that our applicant is going to be listing. When I click on this Add School button, it's going to bring up a modal looking just like this. It's going to require me to fill in all of these fields before clicking Done to save that school information. So the school name, the street, the city, the state, the degree, and the graduation date are all required. If someone accidentally clicks this in error, they can use the little X here in the upper right-hand corner to cancel out of that selection. Or if they update the information and click Done, it's going to edit the information in this table. We'll go ahead and click Save and Next here and jump into the specialty step. On the specialty step of the application, I'm able to indicate that I'm certified, in this case, as a nurse practitioner, the subspecialties of adult and acute care. If I choose certified registered nurse anesthetist or certified nurse midwife, those do not have those subspecialties, whereas nurse practitioner and clinical nurse specialists do. So you can see those are displayed and required based on that requirement. All right, we'll click Save and Next here to jump to our veterans fee waiver step. And you're going to see this functionality quite a bit over the next few steps. So I'll just kind of use this step as an example to talk through it. Here we have 3 questions. If you qualify, you're requesting a waiver of your initial credentialing fee. Now, in this case, I've answered no. However, if I were to respond with a yes, we would have an additional question requesting that we input that WDVA voucher code number into this field. And you can see that it's required. You're going to see this a lot in the declaration, an additional declaration step as well. Just wanted to kind of call it out here. So we'll go ahead and choose no there. We'll go ahead and use the Save and Next button to jump to our license history step. In our license history step, we're asked first to indicate any states in which we've been licensed. Now, in this example, this applicant has been licensed in Wisconsin, so I do have that one checked. I do have a none option if needed, but otherwise I can indicate as many states as I've been licensed in. Below that, we are able to identify the states in which we've been licensed by exam. And of course, in this case, where Wisconsin is the only state that I've been licensed in, I'm also going to indicate Wisconsin is where I've been licensed by exam. So click Save and Next here. That's going to take us into our first step of declarations. Our declaration step have a series of questions that we have to respond to. With each of those questions, if we indicate yes to any of them, typically we'll have a field and we'll be asked to share details about that response. In a couple of cases, we do have just instructions for additional forms that need to be submitted if responding yes to this question. All right, so I'm going to use the Save and Next button again. We're going to move now to our additional declarations. For our additional declarations, we have some definitions that are laid out in the top half of the screen. And so we have some very descriptive definitions of medical condition, chemical substances, illegal use of controlled and dangerous substances, and then some questions relating to those definitions. You'll notice with question number 11, I currently have it indicated with no. If I were to say yes, I am both required to explain as well as to respond to questions 12 and 13. Whereas if I click no, I'm not required to respond to those additional questions. So we'll go ahead and click save and next. Moving into our supporting document step. So here we can see we have a list of documents that could be required. We have some of those marked as absolutely required in all cases. I have gone ahead and uploaded some sample documents there. In order to upload a document, I can use one of these upload buttons. That's going to give me some information about the file size, what kind of files, and also let me know that multiple files can be uploaded. For example, here, I'll click on upload and we will grab a file to be uploaded. And once that file is uploaded, I can click close, and you can see now that file has been added to this list. In this instance, this is not the right file. I've made a mistake here, so I need to remove this, and I can do so using the trash can or delete icon here next to that supporting document.
So this area is an area I do like to stop the video at and just provide a little bit of context. One of the key features of this system is a portal where folks do not have to log in, which allows third parties, so educational institutions, employers, other states, potentially some testing organizations, to directly upload material to the applicant's profile. So there isn't a need to wait to see if material has been uploaded. The applicant will know immediately upon the third party uploading that material that it is in the application and ready for review. In addition to this portal, we are working through the process of creating what's referred to as APIs, or electronic relationships, with a number of third parties, which will allow even more seamless transmittal of application material into applicants' application profiles. And that process will remain iterative. We will continue to add those relationships individually with the myriad of testing organizations that exist throughout the country. One item which we are in the process of completing is the addition of a relationship with the National Clearinghouse. So for those professions that require submittal of transcripts, the applicant will actually be able to go from our portal to the National Clearinghouse to initiate a transmission of a transcript directly into their applicant profile. Currently, we receive those in quite a myriad of ways from different institutions based on their on the way they operate, and it'll be a lot more seamless when we can centralize that through one pathway. So with that, Kim, if we could show the documentation upload portion.
The instructions that are given to the third parties, you're going to have instructions to come to the licensee portal, and they don't need to register or anything like that. They'll go to this third party document upload. And so they're asked to search for an application number, and on that form, the applicant will be instructed to fill out this application ID. So this application number is going to be how the third party references what documents they're submitting, or what application they're submitting for. So we'll go ahead and take that individual application ID and paste it into the application number and search. And so that's going to show us what profession it is that's being applied for, as well as that application number. Once I am confirmed that yes, this is the correct application that I'm trying to provide documentation for, I can use the select button. And now you can see there's a list of different documents that I can provide, which may or may not be coming from the same party. And so if I needed to provide this certification of master's or doctoral degree, I would use the upload button, which gives me our upload modal. And I would find a document to upload on my computer. Once it's uploaded, and then at this point, I can close the window. I don't really need to continue to stay here or save anything. At this point, when we view this application internally, we will see that that document has now been uploaded. So here is the certification or master's doctoral degree, and this is that file that I just uploaded. All right, so once we've uploaded all of our supporting documents that are required, we would then be able to use the Save and Next button, which would bring us to our attestation step. So here, Arthur would be able to indicate that he is a citizen or national of the United States, as well as provide his digital signature after reviewing all of the information and agreeing to sign. All right, so we'll use the Save and Next button here to enter our final step of the application flow, which is our payment step. From here, we're shown a table of what are the fees that are currently being charged, as well as some optional choices that we can make, including ordering a wall certificate or an expedited fee. In this instance, we'll just keep the base fees as the amount, and you can see here, it gives us a total amount at the bottom to be paid is $132. Now, in order to pay and submit this pay for and submit this application, I'm going to use this Pay and Submit button. All right, so when I click on the Pay and Submit step here, I'm going to be taken out of licensee for a moment and into the payment gateway. And so to complete my payment here, it does pull over information about the from the applicant's profile information is brought over. The phone number and email address does have to be typed. And then we can choose our payment method. We can take ACH debit as well as credit and debit cards. Once they've input all the information, I use the continue button to be shown a review step. Select the right state here. They're brought to a review step where they're able to review what is going to be charged and the rest of the information that's been provided, and then they can use the confirm button to make that payment. They're provided with their confirmation number, and then once they click continue, they'll be brought back into licensee and be displayed a success message there as well. Let us know that the payment's been received and the application has been successfully submitted. Along with that, I'm going to get a couple of other notifications. So one notification is going to be a confirmation that my application has been submitted. And the other is going to be a receipt from the system telling me about that payment. Once all applicant supplied documentation and third-party supplied documentation has been submitted, the application will be reviewed and hopefully approved. Once approved, licensees will then be able to log back into the licensee portal and print their license certificate by clicking on My Approved Licenses, using the Action button next to the license for which they would like to download or print a certificate, and then using the View Certificate command. All we need to do is to click Download next to the type of certificate that we would like to download and print, and that certificate will then be displayed and can either be downloaded, printed, or both.
So Secretary Harris, the questions have started coming in. If you're ready, I can give you the first one.
Absolutely.
Okay, thank you. So there was a specific question about when special use authorizations are going to be in the system, but can you also speak more broadly to what the timeline is for the remainder of the rollout of licensee?
So the renewals actually, so for license renewals, they're rolling out this Friday. So subsequent healthcare renewals will be in licensee. We will be, as renewals come up for specific professions, we will be communicating information out to licensees who are impacted to enroll in the new system and to how they would complete the renewal process inside of the new system. The remainder of the professions, primarily business and trades professions, will be phased into licensee over the course of approximately the next year and a third. So through the end of 2023, we will be working to phase in business and trades licenses into the system. Special use authorizations, I think I need to get a little bit more information potentially. In terms of special use authorizations for specific for new applicants, those should be in the system already. My understanding is I believe in the initial wave of applications, we did have, I believe it was with Dennis, a couple of bugs which we needed to resolve regarding special use authorizations. Those should now be resolved, is my understanding. So new applicants should be able to obtain those currently in the system. For applicants who have licenses which were issued in the old system, they will need to continue to utilize the paper form. I do not have an ETA on that. My assumption would be is that as a part of the renewal process, which will move all of the older licenses into the new system, that those should now then be available. But I would need to confirm that directly with the product team to make sure that that's accurate.
Okay, and I've recorded the person who posed the question, so we can follow up on that. There are some questions about average processing time for applications. Also kind of getting into comparing the new versus the old system, but I think also can you share what our current average processing times are, and then also explain how our staff are balancing their work in the new system versus applications that are still handled and that haven't transitioned to licensees. So how are we balancing that new and old system so that everybody's getting kind of fair and consistent attention?
Absolutely. Our 2022 processing times, average processing times is 45 days. So that's 45 calendar days. It's worth noting that that's down significantly. Starting in 2016 through 2021, the 5-year average it was actually 76 days. And the regional averages are between 60 and 80 days, depending on our state counterparts. So the 45 days is certainly a significant improvement. Some of that is certainly due to our efforts with the new program, as well as other efforts we've made relative to the application process. I do think it's worth noting that there are applicants who certainly, as in any average, there are applicants whose processes do take longer for a variety of reasons. And one of the things that we're seeking to do is to be able to better communicate and serve those applicants who may encounter specific issues with their application. We're doing that in a number of ways. One of the things that we've done is we have actually added contract call center staff. Prior to adding that staff, we had 6 FTE to roughly cover 5,000 phone calls a week. We've added about 20 contract call center staff, and we've dropped the call center wait time down to approximately 4 minutes. In addition, as I mentioned at the start of the call, we are in the process of creating the application, the profession-specific user guides to allow applicants to better navigate the processes. So in terms of the average, like I said, we're at 45 days, but in order to make sure everybody experience that it's not just an average, that everybody experiences that that time frame, we need to work on the communication tools and making sure people better understand the process.
Okay, thank you, Secretary. And then there is a question, you talked about this a little bit at the opening, but this is something that we've encountered over the course of the summer as applicants have gotten familiar with the system. It's about the bulk submission of statements of graduation, and whether how we're addressing that, and what kind of options we're looking into for the future.
Yeah, I think it's going to be a multi-step approach, because statements of graduation, while very similar, are not necessarily universal by profession. And so, as I mentioned at the top, with nursing specifically, we are working on changing that application process to better align with our with an ideal business process. Yeah, and it would, while it does not unfortunately eliminate the need for proof of graduation, of which statements of graduation are one way to prove graduation, it will allow more flexibility in the process to demonstrate that the applicant has graduated. And so, for instance, a statement of graduation may be one method. They may also choose to utilize a transcript upload or upload of a diploma as another way to demonstrate graduation from their relevant programming. In terms of some of the other professions, some of those statements of graduation do contain profession-specific information, but I will state that it's not necessarily as time sensitive in those professions as it is with nursing, since in nursing the testing capability for the student was somewhat contingent on the demonstration of graduation, which again is something we're seeking to change. We do continue to evaluate a way to create a bulk upload of documents for institutions that may have to upload documents for multiple candidates, and we would anticipate that those changes will be a part of future rollouts over the course of the next 4 months or so here through the end of the year, in preparation for our next graduation season.
Thank you, Secretary. One of the questions is something that you and I have talked about already. In the nursing application, there is a list of forms that they can submit, but it isn't clear whether all of them are forms that they must submit, or forms or documents. Can you talk a little bit about the kinds of refinements that we're looking to make to those kinds of options that exist within licensee?
Yeah, I will say that the documentation that exists there does outline what is required. How clear it is to the applicant, I think, is going to vary applicant to applicant, which is why I think we do experience some of those, what I refer to as communication gaps between the department and the applicant. In the short term, I would suggest that all applicants should look at the top form on their due diligence checklist, that there will be a link to the front page for their application type. And that front page that is linked actually does lay out very specifically the requirements that must be submitted. And then the subsequent requirements, folks will be notified by staff if that's a required field for them. A good example of that will be if they indicate they have some sort of a criminal background that needs review. Staff will let them know then that they need to submit, I believe it's Form 2282, or it might be 2482, I can't quite recall, in order to start the process for the additional legal review that will be necessary for their application. Long term, we are in the process of reviewing each profession individually to identify ways that we can clarify the specific language or change fonts, change coloring to make things a little bit easier to determine at a glance what is absolutely required.
Thank you. And then there's a question about the permission to test for nursing graduates. And I know that we've talked about that. And can you fill us in on discussions you've had and any steps toward making that a little more seamless?
Yeah, absolutely. So permission to test is contingent on graduation, and it actually, the board is required to affirmatively assert that the applicant is eligible to test. What we are seeking to do is to remove that requirement of affirmative assertion that the applicant is eligible. What does this mean practically? Practically, this means that as soon as the applicant has applied, and provided that they have also gone to the testing folks, which I believe is Pearson VUE is the contracted testing company, to begin the process of scheduling their exams and registering for that system, then they should, with relative automation, be allowed to test. It will mean that proof of graduation, which is a requirement to test, it will be the responsibility of the applicant to affirm that they have indeed completed that requirement before they have gone ahead and taken the examination.
And then I just want to mention something. Thank you, Secretary. There's a question about when, how people can find out when some of these changes have been implemented, or when we make progress on some of the questions. And I would just encourage everyone to sign up for the licensee emails. So as we send out significant updates, that you would automatically get those. Otherwise, you can visit our website. Those will be our primary communications tools for that kind of information. Let's see. So I'm getting a lot of very specific questions, Secretary, that we'll have to follow up with outside of that. There is a question about whether we've discovered anything unique related to medical MDDO licenses that is affecting the processing times, and whether there are any planned improvements to that application process or that specific application.
Yeah, I don't know that we've encountered anything unique, other than, as we can all imagine, our physician licenses are some of our most complex licenses. Physicians and our social work tend to be our two most complex license types, and each requirement that you add to a license does sort of create iteration in the process. Which means that, for instance, a physician license, almost without exception, will take longer than, say, a nursing license. In terms of process improvements, I will say broadly, healthcare licenses are complex in that they are tied to both federal and state Medicaid, Medicare requirements, which means that it's difficult sometimes for us to make unilateral changes. But to the extent that we can work with our medical examining board to make changes, that's a process that we are engaged in. I have made this ask of the nursing board, and they have been kind enough to provide us with a board liaison to the department to review the requirements for the license, to again streamline and synchronize to the best of our ability the application process. I have calls scheduled with many of the board members actually for later today, in which I'll be asking each of the boards to assign a liaison to the department so that we can undertake that process review with the board and identify what rules are currently in place, which the board would be open to changing to help us better align the process to move more quickly.
Thank you. So there's a question that in the past, advisors and schools have given students rough estimates for how long after graduation certain things will happen. And for us, we base our estimates based on time of application, not graduation. So what advice do you have, or what recommendation do you have for schools that are trying to help their students prepare and anticipate the licensing process and the amount of time it will take?
Yeah, I mean, I think the easiest way to talk about the time it will take is in the context of how quickly can the applicant line up the necessary documentation. So I would encourage applicants to review the form, that front page I mentioned, which is the top requirement in their checklist, as soon as possible, to make sure that they have all that material ready, or are working with the relevant third parties to prepare that material. As I mentioned, the 45 days is an average. I've seen licenses issued in as few as a single day, but I've also seen others take much longer. And often that is directly related to how quickly the application material is provided to the department. I will say, and this kind of gets at a question that was asked earlier that I don't necessarily, I think I may have missed this part in my previous answer. There was some questions about the differences between the old system and the new system. And I think there are a couple of key differences which speak directly to this issue. In the old system, application material was emailed, faxed, or mailed to the department. And again, often iteratively, and that material was then needed to be hand entered by staff. And so that process of data entry and that process of receiving materials iteratively added a minimum of 3 to 4 weeks to the process, even for applicants who had immediate access to all of the relevant documentation. So in this new system, when application material is submitted, the department knows immediately that application is ready for additional review. And so that key feature is part of why we are seeing the dramatic improvement in average processing times. But again, as I stated, with any average, you're going to have those who exceed it and those who are better than. And in terms of helping applicants prepare, just submitting as complete an application as possible. I think another key item that I've seen in my work approving certain types of licenses is that there are a portion of applicants who don't necessarily, they submit the application, but then don't necessarily log back in to submit the additional documentation that's relevant for their application type. And so it's important that they check their checklist with regularity to make sure that material is being submitted either on their behalf or by themselves, so that we can move their application forward. I think the last thing I would stress is just to be detailed. For certain types of applications, there are forms such as supervised hours forms, which we do see a high rate of error in terms of making sure that dates and supervisors and signatures are all reported timely and accurately. That is actually a specific issue that I intend to bring up with our social work board to see if we can better align that submittal process to ensure that there's less error rates on those forms, because that's an example of sort of some of the granular items that do create opportunities for delays in the process.
And then are there any steps that applicants can take before they graduate? There's a lot of interest in some questions in the chat about what people can do so to potentially accelerate the timeline. So can you talk about what our recommendations are and what control the applicants do have over that timeline and the length of time it takes from application to licensure?
Yeah, I mean, it's really what I mentioned before. It's about being detailed and making sure that all of the material that's required in your application is submitted. I think the other item would be is constant communication with the third parties who are required to submit application material on your behalf. And then the last thing I would say is just testing as soon as you're eligible. There are many instances which sort of contribute to longer timeframes where folks maybe take some time to test. And for some folks, I will say that's wholly appropriate. Maybe they need additional time to study, whether it's for a statutes and rules exam, which is one type of exam for some professions, or if it's a national exam. And that is one reason why we did place an emphasis on trying to work with the nursing board to identify ways to streamline that examination process, because we want to truncate those timeframes for applicants wherever possible. But being detailed is certainly another key component. The last thing I'll state, just to kind of dispel a rumor to a certain extent, is some folks try to apply before graduation, and that doesn't necessarily expedite the process unless your profession is eligible for some type of a pre-graduation temporary licenses, which very few are. But the reality is most types of certificates, even temporary ones, require graduation. And so there's very little that the department can do to move your license forward until you've fulfilled that requirement in most instances.
Okay, and then there's a question, and this has come up too from a lot of employers or academic advisors or others want to help students and their employees with the application process and would like proxy access to get into their applications to fulfill some things on their behalf. Can you talk a little bit about the security concerns with that and ways that we are looking to assist and provide support for those individuals who want to provide additional support to applicants?
Yeah, absolutely. I think it comes down to the two-part components I mentioned earlier that we're working on, which is both the profession-specific application material, the step-by-step guides. The second thing is we are working on the application status portal. I think there are a couple components which sort of do provide me cause for concern, if you will. In our existing application portal, there often is at least acknowledgement of an applicant undergoing a legal review. And so we have very specific labor law concerns relative to providing that information. So that's just kind of one example of the differences that folks will likely see in the new application status lookup, is that we will not be providing information on the legal review process if an applicant's required to undergo that process. However, part of the reason why I'm holding roundtables with clinics is to gather what types of information is valuable to recruiters and clinics in the application process, and hopefully building in, or not hopefully, to build in as much information as is possible. Another feature that we will be making a change to in terms of the new application status portal is it will be driven by, the lookup will be driven by the application number. And in our current system, you can look up any applicant by their name or their application number, and we'll be eliminating the name lookup because truthfully, anyone who is looking up an application status should be able to obtain that application number from the applicant if they have a need to view that application status. And so again, it's really about making this more of an applicant-driven process. We want them to take ownership over the process and the communication with the department. I think I went a little far afield here on my answer. So Jen, if you could help me remember what parts of that question I haven't answered yet.
No, I think you covered most things. I did want to make a point of order, if I may, for the remainder of the meeting. Several people have posed specific license inquiries in the chat. So like I've been waiting on this for application number XYZ. I'm copying the chat and we'll be following up on those afterwards. However, the names that appear with the chat are not always complete. Sometimes they're just first names. And so if you have posted those specific application questions, I would ask that you also email them directly to me so that we can triage them, and I'll put my email in the chat so that you have it. But it's a little hard for me to piece together all the information we need in order to follow up with you from what is here. So I'm going to do that now. And then I'm going to look and see if any new questions have come in, because there seem to be. So Secretary, there seems to be kind of continued questions about this statement of graduation and how it relates to approval to test and refining our system related to how that's submitted. So I know you've covered that already, but since there are continued questions, can you just give us an overview again of what we're working to accomplish and how we're hoping the system will work to, or what frustrations we're trying to eliminate with refinements to the system?
Yeah, absolutely. So statements of graduation, as I mentioned earlier, are one way to demonstrate graduation. Graduation is a requirement in order to sit for specifically the NCLEX examination. And the department, as a result, is required to affirmatively review and approve that the proof of graduation. What we're seeking to do is to eliminate that step. It does not eliminate the requirement for graduation, but it eliminates the need to review that material in order to allow somebody to test. And so then we can we can work with our vendor to automate the testing approval. The other remaining component of that is in order to approve somebody to test, they do have to be registered for the examination with Pearson VUE. And so it's kind of a two-step process on the applicant end. They will both have to submit an application as well as register for the exam. And then we will be able to create automation around the examination occurring.
And there was a question about renewals that are in progress now, because you had mentioned that renewals are moving over to the new system. And so my understanding, and I know you can elaborate on this, is that renewals that are in process now are continuing with the process that's already been communicated to license holders, and that the first two professions that will be renewing completely within licensee are nutritionists and podiatrists. Can you confirm that or correct or elaborate a little bit?
Yeah, that's correct. Any process that's been started will continue as was started, and podiatrists and nutritionists will be the first professions to move into licensee. We will be communicating to those professions and subsequent professions as renewals timeframes occur to provide them with information on how to register for the system, confirm their profile, their application profile in our new system, and then to be prepared to renew their license when the time comes.
Okay, and Secretary, we are at time. There are a few questions that are that we haven't had a chance to go to, so I'm going to copy those, and we'll see what we can do to follow up on those as best we can, if we can identify the individuals who have posed the questions. And then I did put my email in the chat, so hopefully if you would like direct follow-up, you can contact me directly. So I'd like to thank everyone for attending today and for your participation and your feedback. It definitely helps us identify refinements that we need to make. And the Secretary has talked about some of the things that we're working on, and many of those things came out of sessions like this. So we truly appreciate the time you spent with us today and the input you've provided. And we will be hosting more of these, and we look forward to your continued participation and also encouraging others who have questions to participate as well. Now I'll let the Secretary close things from there. Thank you.
Well, I think Jen said it pretty well. Just want to thank everybody for their time today. As Jen indicated, and I'll reiterate, this feedback directly contributes to changes that we make and improvements that we are seeking out. You know, I just want everyone to know how valuable it is. And certainly for those folks who had applicant specific questions, we will be following up as Jen mentioned to address those issues more specifically. So thank you for your time today and have a good morning.
Thanks.